Hello everyone, good evening. My name is Otwago Chiko Anthony. I'm popularly called Dr. OTR6. I'm a final year medical student of the University of Port Harcourt, Rivers State. It is my pleasure to join you today on our #1 YouTube channel, Sam Tony the Optimist. Today we'll be talking about a very interesting topic in the health sector, unsafe abortion. Now, I call it a very interesting topic because it's a plague that is ravaging our world today, especially in the developing countries like ours in Nigeria. Now, what is unsafe abortion? Unsafe abortion is the termination of unintended pregnancies by unqualified personnel in an inappropriate environment and use of inappropriate methods or materials, or any of these at all. Now, there's a rising incidence of unsafe abortion across the world, especially in developing countries like ours here in Nigeria, and this is largely linked to the rising incidence of unwanted pregnancies in this region. And for this, there are documented risk factors for unwanted pregnancies in this region, as we see in our country Nigeria. Example: young age group, which is in high dominance in our country Nigeria and the population of our country Nigeria. Poor educational status across the youth in these developing countries. Pattern of contraceptive use. Now, for this, in this region, these people are not usually aware of the different kinds of contraceptives and how they are being used, and this also leads to an increase in the incidence of unwanted pregnancies. Now, there are some certain religious beliefs that are against the use of contraception, and because of that, people end up engaging in unprotected sexual intercourse, and here we go with the unwanted pregnancy issue and unsafe abortion. Now, abortion laws, which are usually stringent and makes these quacks to engage in unsafe abortion. Abortion methods, which is actually what makes the abortion unsafe. Abortion methods: using inappropriate equipment, using inappropriate tools, carrying out the abortion in an unsafe environment. These are very rampant in the developing countries. These are some of the few risk factors that could be attributed to the rising incidence of unwanted pregnancy, and as such, to rising incidence of unsafe abortion. Now, I haven't talked about the rising incidence of unsafe abortion and the risk factors that are associated to this rising incidence of unsafe abortion. I would love to talk about the methods through which these unsafe abortions can be carried out, and it ranges from use of herbal concoctions, which can be used orally and vaginally, sometimes use of weird drugs. I've seen people say that in a bid to get rid of an unwanted pregnancy, they take ampiclos bisham just to get rid of an unwanted pregnancy. It's crazy. I've seen people say because they want to get rid of an unwanted pregnancy, they take chloroquine, quinine. You see people carrying different kind of mixtures, dye, dogoyaro leaf, putting it through their vagina just because they want to get rid of unwanted pregnancy. Now, you can imagine the risks that is involved in that. Now, beyond the use of all these oral drugs and vaginal drugs, some persons even go as far as using needles, using all forms of sharp objects, passing through the vagina. And this is where the real complication is coming from, which we'll talk about as we go on in this particular series. You see them using needles, you see them using some sharp objects in a bid to curettage the embryo out of the woman's womb, and it's actually very, very crazy. At some point, it's actually even very scary. I've seen clips and videos of people doing this, and I wonder, like, how do you allow yourself pass through this pain just because you want to get rid of an unwanted pregnancy? And not just getting rid of an unwanted pregnancy, you put your life at risk as well. You might lose your life there, or you even put your gynecologic history or your gynecologic life at risk. There are complications associated with this, which we're going to talk about as we move on. All right, so talking about the effects of unsafe abortion. Now, this is the real deal, the real scary thing about unsafe abortion: the harm it poses, the harm it causes to the life of the individual that engages in unsafe abortion. First amongst many is vaginal bleeding. Some of these people bleed so much to the point of bleeding to death because of the trauma that the whole unsafe procedure and the inappropriate procedure must have caused to their womb and the vagina, as the case may be. Another effect will be abdominal pain. They come down with severe abdominal pain because for some reasons this unsafe abortion doesn't completely evacuate the pregnancy, doesn't completely evacuate the product of pregnancy, and so because some of those products are retained, the uterus continues to contract, and it causes some severe abdominal pain to them, which is very discomforting. I can tell you it's very, very discomforting. Now, some of them could come down with abdominal swelling, as the case may be. Now, fluid collection could lead to that abdominal swelling. Some of them could come down with offensive vaginal discharge. This is common, very, very common. I can tell you, very common. amongst people who engage in unsafe abortion, this offensive vaginal discharge, because of the method used and the lack of sterile materials used to carry out these procedures. It leads to the introduction of bacteria and different microorganisms that could cause infection around the vagina and the pelvic area and causing all this offensive vaginal discharge. Now they could be dizzy depending on their level of blood they lost. They could be dizzy, some of them even faint because of the level of blood they lost. They become anemic and they could just fall flat and faint. Fever is common, vomiting is also common. These are some of the symptoms that are associated or that are seen in people who engage in unsafe abortion. Complications could also involve sepsis. Now when we say sepsis is an overwhelming infection in the body. Now due to the use of all these unsafe materials to carry out unsafe abortion, like I said earlier, there could be introduction of microorganisms, bacteria and other microorganisms that could cause infection. And now this infection could become so overwhelming that it begins to affect organs. And that is where sepsis comes in. All right. Now the end point of all of this, death. Now it's very important that we curb this rising incidence of unsafe abortion, because we've also found out that death among many young women in these developing countries comes from unsafe abortion. Now I haven't talked about the effects and complication of unsafe abortion, which is actually a real deal in this series. Let us talk about another important aspect of this topic: prevention of unsafe abortion. Now the prevention of unsafe abortion is largely linked to the prevention of unwanted pregnancy. What I mean by this is, if we can reduce the rising incidence of unwanted pregnancy, we are also reducing the rising incidence of unsafe abortion. People engage in unsafe abortion because they don't want to keep that pregnancy. If the pregnancy was intended, man, all it takes is to register for antenatal and full gestational age, you deliver your baby. So let us talk about how we can prevent unwanted pregnancies. It begins with abstinence. If you do not engage in unprotected sexual intercourse, you won't get pregnant and you won't engage in unsafe abortion. If you must engage in sexual intercourse and you know you're not ready to get pregnant, all it takes is to use contraception. Now contraception is not just limited to this condom. No, condom is just one of it. It's the barrier method. It's actually the cheapest. It's actually the easiest method of contraception. From the chemist to the house, boom, it works. That's one of it. There are other methods of contraception, which involves use of drugs. It could be pills swallowed orally. It could be injections given at different periods. It could be monthly, 3 monthly. There are implants, which are also very good methods of contraception. They are proven method of contraception. All of this, if put in place, can reduce the rising incidence of unwanted pregnancy. Now, should in case you engage in unprotected sexual intercourse, let us assume that you were carried away by the moment and boom, you couldn't access condom and you just get involved in unprotected sexual intercourse. There's also what we call the emergency contraception. Now, it is stated that within 72 hours of engaging in unprotected sexual intercourse, if you can take emergency contraceptive, chances of getting pregnant become reduced. When I say emergency contraceptive, what I mean is post-pill, post-enol. This is what many persons use to prevent unwanted pregnancies. If all of this can be done, we can reduce unwanted pregnancies and unsafe abortion. The government agencies also have a role to play in the prevention of unsafe abortion. This could be by educating the public more on contraception, subsidizing these contraceptives, making it readily available to even as little as the primary health centers so that people can access it. Because if you even find out, it's even in all these rural areas where these people engage in unprotected sexual intercourse, get pregnant and then engage in unsafe abortion. So let us tackle it from the grassroots. And you listening to me, you have been able to see different ways to prevent all of this. So if you've heard this, why do you want to engage in unprotected sexual intercourse? You now know that the reason why people engage in unsafe abortion is unwanted pregnancy. If you don't want to get pregnant, then please be protected. Thank you for listening to me. My name is Otuaga Ochukwu Anthony, and I still remain Dr. OTR6. Thank you, Sam Tony, the optimist, for inviting me to your channel. I know this won't be the last of it. I'll be here time and time again to give you different health talk. God bless.